The National Coordinator of Network of People with HIV/AIDS in Nigeria, Mr. Edward Ogenyi, has raised alert over the increasing number of AIDS-related deaths owing to lack of access to anti-retroviral drugs for people living with HIV/AIDS. During a news conference in Abuja, Mr. Ogenyi said of the 140 billion naira budgeted for the implementation of the President's Comprehensive Response Plan, only 8 billion naira has been appropriated. The Assistant National Secretary of the network, Hadiza Jibrin, who also spoke at the event, appealed to the federal government to urgently intervene in the provision of HIV/AIDS test kits in order to save lives.
Most of our clients, we are now getting back to the era of paying for consultative fees and paying for test kits. If we look at it, most of our Nigerian population, we are in the stage of poverty. Especially our people, most of our people living with HIV and AIDS that don't even have good jobs. Most of them are not even in the labor market. How are they going to pay for consultative fees, and they are coming from a rural area?
Specifically, the PCRP aims to avail 80 million Nigerians the opportunity to know their HIV status. The PCRP also provide an opportunity for an additional 600,000 individuals living with HIV and AIDS to be enrolled on treatment. It also provides for the treatment of 244 HIV pregnant women for prevention of mother-to-child transmission, as well as the provision of combination prevention services for 500,000 most at-risk population. Under the PCRP, it is also expected that the country will activate additional 2,000 ART service delivery points. While the President has stood up squarely to this challenge that he himself clearly identified, people living with HIV and AIDS in Nigeria has observed with great dismay that none of the targets and indicators or milestones set under the PCRP has been achieved due to lack of release or paucity of release from the Federal Ministry of Finance.